Hi, my name is Greg Katz, the host of Surviving Strong TV. And I want to just bring up one particular issue today, and that's the issue of trust. You know, you hear about, from Superman, you used to hear about truth, justice, and the American way. When you take the stand in the courtroom, you swear to tell the truth, the whole truth, and nothing but the truth. So truth is really important, and in healthcare, we don't really talk a lot about it because I think it's implied, and yet there are a lot of times when we're not absolutely truthful. And why is truth important? Well, it impacts how your medical provider prescribes care. So for instance, let's say that you are supposed to take X number of pills a day and you consistently miss a particular dose. Now, if you saw a video a couple of months ago, I talked about compliance, and this goes into compliance about whether or not you're following the instructions, but this carries it one step further, because this is now asking you to go to the doctor and say, look, I'm having trouble either taking a particular med because of a time of day, or I have to take it with food or without food, or I just forget at a particular time of day. Or you're just not taking it for whatever the reason. Maybe there's a side effect you don't like, or you're still sort of combating the idea of being sick. Whatever it is, these are things that your doctor needs to know, because the doctor's assumption is you're taking the medication as prescribed, and then they're looking and saying, but we're not getting the results that we hoped for or desired. So it alters it that way. But there are other areas in which truth needs to really come into the exam room or the doctor's office. And that in particular is usage of things like alcohol or tobacco, and what other non-prescribed medications you might be using. And that is because things, medications, substances, tobacco, interact in your system chemically, and if you're not really sure what that will do, you could be doing more harm than good. The other part of it is that things like alcohol and tobacco impact your respiratory system and your circulatory system. So I know it's hard to be truthful, but the doctor might be able to help you either with education or resources or changing a treatment regimen. But you have to know the facts, and they have to know the facts. Otherwise, the partnership is really destined for disaster. So I'm saying, I know it's hard. I know that there may be a hesitancy. Some of it may be shame that you're dealing with. Shame of it may be embarrassment. But drop it. Get rid of it. Unload it. And try truth. And see how that changes your health, improves your health, lightens your load, boosts your immune system, and just makes you feel better about yourself. So for more tips on patient empowerment, health advocacy, and just how to feel better, go to www.survivingstrong.com. And until next time, I'm Greg Katz. Be well.